Darcy Nikol Bryan, an OBGYN, and Bob Grayboyes, a health economist at the Mercatus Center, have teamed up together to write a chapter entitled Unshackle Providers, Don't Waste Their Training. Bob, that's a really provocative title. Can you explain it for us?
Sure. Thanks, Brian. America's healthcare providers are stretched thin, and state regulations prevent them from making the most of the time and training they do have. It's difficult for many Americans to get timely appointments or sometimes any appointments at all. Darcy and I focused on three ways that states waste providers' time and training. First, licensure regulations make it difficult, expensive, and time consuming to provide care across state lines or to make use of international medical graduates. Second, scope of practice regulations needlessly prevent nurses and others from doing tasks for which they are trained and competent. And third, mandatory collaborative practice agreements force nurses and others into time consuming, costly business arrangements with limited benefits. All of these detract from the quantity and quality of care available.
Thanks, Bob. Darcy, can you talk as a doctor about who these restrictions particularly harm?
I think most impact is in those underserved communities in rural America, in urban centers, in linguistic minorities. But ultimately, it's going to be all of us who are going to be adversely impacted. At some point, we're all going to need to be urgently evaluated and seen. I see it on a daily basis where my patients are struggling to get the care that they need. And there's a lot of suffering out there. And what's hard to see is a lot of it can be changed with good policy decision making.
Darcy and Bob, what recommendations do you have for states?
Well, I would initially say if we could do something about state licensing. Just for example, as a provider, I've been nationally boarded, but I can't practice urgently or emergently in a different state or practice utilizing telemedicine unless I have a license in that state. And that's a true handicap.
Some states, notably Arizona, have made it easier for doctors, nurses, and other providers to practice after moving to another state or to practice across state lines, as in telemedicine. States can relax scope of practice laws to enable advanced practice registered nurses and others to provide whichever services they're trained in and certifiably competent to perform. A number of states allow nurse practitioners and other non physician providers to practice autonomously. Finally, I'd like to say we're going to be facing real shortages of all these providers in the next 30 years. We're really not going to have a choice other than to loosen up the regulatory regime.
Thank you both so much for writing this important chapter and for the recommendations that you made.